afternoon. Women's health physical therapy specialist, it's not well known for most of the people. I will try to give a very brief idea what is this specialty included. This specialty includes urology cases, gynecology cases and urogynecology, menopause cases, osteoporosis, chronic pelvic pain, pregnancy and childbirth, and sexual health. This service started in our organization since 2005. We started at that time to treat urinary incontinence, fecal incontinence, pre-postnatal pregnancy exercise program. After that, we expanded our service, and at 2012 we added sexual health. At 2015 we added all the chronic pelvic pain under this service, and at 2018 we opened a new service. We called it men's health, which treat men for all the problems that's related to men. 2019 we added the oncology and neurology cases who really complain of sexual health or any type of urinary or fecal incontinence. We use different modalities of treatment depend on the patient cases. For example, we are using manual therapy, dry needling, electrical stimulation, electromagnetic field stimulation, dilator. We use the special weight, which is we call it cones, and we used, as I mentioned, dilators, and we used pelvic floor strengthening exercise, or which is well known for all the female as a Kegel exercise. We used Pilates and certain poses of yoga. All of these modalities of treatment based on evidence-based study, and we published as a department 13 articles related to this specialty to show the improvement of our patient when we use different modalities, as I mentioned. We trained a lot of therapists from inside the kingdom and from the Gulf, and I hope that I give you a very brief and quick idea about what is the women's and men's health means to you. Thank you.
Hi, my name is Mohammed Takroni. I'm a physical therapist here at King Faisal Specialist Hospital and Research Center, Physical Rehabilitation Department. Actually, the department has three major sections here: physical therapy, occupational therapy, and orthotic and prosthetic. As an inpatient supervisor, I'm going to talk about the physical therapy part and the inpatient section. Actually, in inpatient section, we have a lot of services, and we see a lot of cases. But talking about the sections we have in inpatient, we have, for example, cardiac rehabilitation, orthopedic cases, oncology, orthopedic, also BMT, and we cover also pediatric here in the main hospital and in CCC, which is King Fahd National Children Center for Cancer. And also we see a lot of cases. Talking about the cases that the inpatient covers, we deal with a lot of high risk conditions. Talking about post-open heart surgery cases like CABG and valve replacement, post-total hip and total knee replacement, post-bone marrow transplantation, and also going back to the cardiac cases like post-ECMO, post-left ventricle assisted device, dealing with pulmonary cases or lung transplant. We also have an oncology, stem cell hematology patients, and also we deal with cancer patients. And we have a lot of cases actually in ICUs, where we deal with different internal medicine or post acute condition cases. That's almost all about the inpatient services that we cover in inpatients here in Physical Rehabilitation Department in King Faisal Specialist Hospital. Thank you so much.
Orthotic and prosthetic services provide services to the patients who have musculoskeletal and neurological needs. We provide them with the external devices to treat their condition. We also provide artificial limbs to the people who have lost their limbs due to one or other reason. It could be accidents, it could be a disease or disorder of some sort, or they could be born with it. Orthotic and prosthetic service is a very significant department or service provider in the hospital. We've been here for decades and we've been helping patients for decades. We are accredited internationally by NCOP, which allows us to do residency for our graduates, both national and international, and that in turn qualifies them for board certification in the United States, which is a big achievement for our students here. We are pursuing the latest technology in providing devices to our patients, such as 3D printing is at forefront, and we're very advanced in that technology. 3D printing technology ensures that the patients get the best device and they get good fit, and it is all done digitally at a record time, at a good time. This also provides us networking opportunity with other entities all across the globe, where we connect with other entities who are specialized in their field, and we collaborate and coordinate and provide best services for our patients. Thank you.
Physical therapy outpatient services are designed to help patients manage their symptoms and improve function, thus the quality of life. A variety of services are available, ranging from general musculoskeletal disorders management, neurological disorders, to subspecialized services like women's health, vestibular rehabilitation, cervicogenic headache and dizziness management, scoliosis management of both adults and pediatrics. The expansion in our services is always based on need and in an alignment with the organizational strategy of the King Faisal Specialist Hospital and Research Center. We are also committed to make our services more accessible to our patients by the implementation of the virtual care, which takes into consideration our culture and the needs of our patients.
Assalamu alaikum, my name is Mohamed Omar Hussein. I'm the Occupational Therapy Supervisor in King Faisal Specialist Hospital. In occupational therapy, we provide services for both adults and pediatric in the outpatient and inpatient settings. Our major role with the patient is to improve their independence and safety at home, and also in their direct environment, such as their work and also with their families. We also do treat the upper extremity. We see cases ranging from musculoskeletal disorders such as tendinitis, and also cases of trauma where we see fractures of the hand, wrist and elbow, both conservatively and post-operatively. And we also do treat patients with congenital anomalies, mainly in the pediatric population. We also do offer services for patients who have undergone nerve or tendon repairs and reconstructions. and we are specialized also in providing and fabricating upper extremity splints, both static and dynamic. We also do assistive device as recommendations for improving the patient's independence at home and also maximizing their safety. In the pediatric population, we also offer sensory integration assessment and recommendations in terms of exercises to improve their independence, and also we do improve fine motor skills and also writing skills for the pediatric population. And finally, we do also assess the cognitive abilities of the patient and physical abilities when related to any neurological conditions such as stroke. Thank you for your time.